Are we ready to go? Good afternoon or good evening to all of you. And once again, welcome to the daily press briefing to give you an update with regard to the situation of COVID-19 in the Gambia and beyond. Today, we'll be reading the 55th National Situational Report to you, and it's going to be done by Dr. Mustafa Bitey, Acting Director of Health Services, on behalf of the Honorable Minister of Health, Honorable Ahmed Lamin Samate. And I invite Dr. Bitey to read out the statement to you.
Thank you very much, Mr. Njai. Good evening, I think, to all of you once again. I'll give you the update, the usual update of the COVID response. So this is the 55th National Situation Report since the confirmation of the first case of COVID-19 in the Gambia on the 17th of March 2020. No new laboratory confirmed case of COVID-19 has been registered. Out of the 19 laboratory test results received, 8 are new tests conducted and 11 are repeat test results. All of the 8 new samples collected tested negative for COVID-19, and of the 11 repeat tests, 4 are active cases currently receiving treatment, while 7 are persons under quarantine at present. All repeat tests of the 7 people under quarantine returned negative for COVID-19. They will have to complete the mandatory period of quarantine now. Of the 4 active cases that had repeat tests, 3 are still positive results, and 1 was a negative for COVID-19. This is the first negative results for case 020. So he will have to be resampled again in few days to ascertain recovery status. While 6 new persons were taken into quarantine, 13 individuals were discharged after testing negative for COVID-19 upon completion of the mandatory period of quarantine. The country currently has 62 persons under quarantine, 10 active cases, and 1 probable case. Globally, since 31st December 2019 and as of 18 May 2020, a total of 4,890,677 cases of COVID-19 have been reported. Of these, 320,125 deaths were registered, and 1,907,361 recovered from the disease. Senegal recorded 2,544 cases, 1,076 recoveries, and 26 deaths. Currently, we have 62 people in quarantine. A total of 1,495 tests were conducted, and 24 are positive. 419 people completed quarantine, 789 contacts traced, and 310 people completed follow-ups. Daily coordination meetings are ongoing. On surveillance and laboratory, the following activities are ongoing. Regional RRTs, surveillance officers, and contact tracing teams are currently receiving a 3-day training. Farafenye North Bank East Quarantine Center has opened. 22 low-risk contacts completed mandatory follow-up and have been discharged. 52 Gambian children expected back from Senegal. Minister of Health currently working with Minister of Women and Children and Social Welfare and other partners to prepare for their return. On logistics and security, Carnifin East COVID-19 task force comprising the security forces embarked on a sensitization exercise to all markets within the Carnifin municipality and engage vendors on practicing social distancing and adhering to the stipulated opening and closing times for business. Carnifin municipality also combined security task force embarked on a patrol around the Senegalese embassy and engage people who were receiving support from the embassy to practice social distancing and as well report any suspected case to the 1025 hotline for follow-up. Anti-crime unit embarked on border patrols within West Coast to monitor border activities and to avert smuggling of people and goods in and out of the country. On case management, we said 10 COVID-19 patients currently receiving and responding to treatment. A number of COVID-19 research proposals have been developed. Some have secured funding and others are awaiting ethical approval. First phase of Namban Clinic refurbishment has been completed and it has been handed over to the Ministry of Health. Psychosocial support, working on reintegrating discharged persons from quarantine into their communities and families. On risk communication and community engagement, 7 TV and 20 radio programs successfully conducted, 1 press briefing conducted, 13 communities and 121 households sensitized or engaged in COVID-19 preventive measures. Summary of social media activities. There are 4 Facebook and 2 Twitter posts shared with a cumulative engagement of 29,165 people reached. Summary of calls made to 1025. A total of 309 calls received. 285 were COVID-19 related and 24 were non-COVID-19 related. 8 were booked for further follow-up by rapid response teams and 13 booked for follow-up by the quarantine team. Regarding our next steps as the ministry is to engage and provide support to the traditional healers in adopting safe behaviors and disseminating COVID-19 messages, orientation of regional governors and district chiefs on COVID-19, security to open a post at Ker Ardo as it is becoming a major route of entry into the Gambia, to consider testing low-risk contacts before discharge upon completion of mandatory follow-up. All SOPs to be revised in order to cater for gender and differently abled people. Inclusion of immigration in the RRT to facilitate the deportation of non-Gambians sneaking into the country. Strengthen surveillance at all points of entry. Engage private pharmacists to report clients presenting flu-like symptoms to rapid response teams, and also strengthen rapid response team and contact tracing teams at all regions. On the availability of medical equipment, especially ventilators in the Gambia, the Ministry of Health would like to assure the general public that the Gambia has 20 ventilators, both in stock and in use. Ever since COVID-19 hit the Gambia, none of the patients admitted has used ventilators so far. We thank God for this and hope their use may not arise. To conclude, the public is requested to wait for further announcement from the Gambia government regarding the state of. Meanwhile, as we approach the Eid al-Fitr, locally known as Korite, we would like to appeal to the general public and to all imams to continue practicing social distancing. In addition, we would like to urge the public to continue to cooperate with the authorities on matters related to COVID-19 and its associated preventive and precautionary measures. We request the public to remember us and COVID-19 in your prayers tonight. COVID-19 is real. It calls for no discrimination or stigma against COVID-19 affected individuals and families. Thank you very much for your kind attention.
Thank you very much, Dr. Bite. I am now going to the other part of the ceremony, which is the reading the press release regarding response to the GMC leader, Mr. Ahmed Fati's claim on the poor conditions of our quarantine centers. And as the spokesperson, I'm given the responsibility to read this statement to the general public. Following information circulating across various media platforms and other circles, including the recently concluded press briefing regarding claims of poor conditions of the quarantine centers, particularly the Badala Park Hotel, the Ministry of Health would like claims. Recall that the GMC leader, Mai Fati, was intercepted together with his wife, male child, and the driver of the private vehicle he was traveling in upon return from the Republic of Senegal by health officials on duties at the Amdalai point of entry, that's the border post, and taken to quarantine from the 20th April to 13th of May 2020. Mr. Fati said, and I quote, "When I was taken to my room where I was isolated, I find nothing there," according to the Voice newspaper, May 14th, 2020. The Ministry of Health would like to urge the general public to disregard this information as all the all the quarantine facilities with hotels, they all have hotel standards, such as beds are available, standard beds are available, television sets are available, air-conditioned rooms, dining tables, refrigerators, chairs, shower, and room services, as well as health services such as psychosocial and medical care during quarantine. This can be attested to by a group of 19 journalists from different media houses on the 17th of May 2020, at the time when Mr. Fati and his family, that's wife, male child, and the driver, were serving their quarantine period. The assessment visit of the media to the quarantine center that housed Mr. Fati and family was broadcast on the mainstream and online media for wider public consumption, and their report would have indicated that the facilities are not available, but I'm sure all of you were there and you have seen it for yourselves. Regarding claims of the lack of face masks for health personnel at the quarantine centers, the Ministry of Health would like to inform the general public that as part of its policies, all health personnel at quarantine, treatment, laboratory centers are provided with personal protective equipment such as face masks, gloves, etc. In addition, persons under quarantine are provided with face masks throughout their quarantine period. According to Mr. Fati, and I quote, according to the Voice newspaper, May 14th, 2020, Mr. Fati, based on his conversation with some frontline health workers during his time under quarantine, he realized that some of these health personnel have to borrow money in order to get their families' daily subsistence. The Ministry of Health would like to inform the general public that health workers are civil servants who are receiving their monthly salaries from the Gambia government on time. The government does not give daily subsistence allowance for upkeep of their families, but the Minister of Health is providing incentives for all frontline health workers, including those at the quarantine centers. An initial amount has been paid to all those personnel working at the quarantine center, and plans are at an advanced stage for additional payment of incentives to all frontline workers, including personnel at the quarantine facilities. Mr. Fadi said, Some people were picked from streets and taken directly to quarantine centers with only a shirt and trouser, adding that some of these people spent almost all their quarantine with the same clothes, according to the Voice newspaper, May 14, 2020. The Minister of Health would like to inform the public that there is no restriction on people under quarantine to be provided with clothes and other basic needs, which are channeled by their families through our personnel attached to the centers. Persons on quarantine are equally allowed to communicate with their families and loved ones through telephones without restrictions. The general public is hereby informed that during public health emergencies or pandemic, putting people in quarantine or isolation is mandatory as indicated in the National Public Health Act of 1990 and the International Health Regulations 2005. As the best, which are also best strategies to avoid further transmission of diseases in any given area. During the quarantine period, the Minister of Health ensured the provision of 3 meals to each person under quarantine, as opposed to the claim that only 1 meal is provided to the people on quarantine. Mr. Fadi was given the exceptional privilege to cook his food, his choice of meal, whenever he feels like doing so at the quarantine center. While on quarantine, he has been given the privilege to be able to have his own food prepared by the wife for his own consumption. That is something that we have given him as a privilege. In the Gambia, the government, through the Minister of Health, is using our mega national resources to provide standard hotels as quarantine centers at no cost to the persons on quarantine for a period of 14 days. This is not the case in many countries where persons on quarantine have to foot their own bill of all services provided. In some cases, persons on quarantine are lodged in schools, stadiums, or in prisons. The Minister of Health would like to assure the general public that the welfare of frontline workers and persons on quarantine are given much attention at all times. We would also like to assure the families of those on quarantine that the Minister of Health consider the plight of their loved ones and will continue to give the best support needed. The Minister of Health solicits the support and cooperation of the general public in relating accurate information, especially in this trying moment when all are expected to work collectively against COVID-19 pandemic that no one ever expected. I thank you for kind attention.
Thank you very much, Director of Health Promotion and Education, Mr. Modunja, who is also the spokesperson of the Ministry of Health and leader of the Risk Communication and Community Engagement Team. Thank you, Dr. Bite, for the update on behalf of the Minister of Health, who is also the chairman of the National Health Emergency Committee. Ladies and gentlemen of the press, the floor is open for questions. Your name and your media organizations. S'il vous plaît. Yes, Ramadan, yeah, okay. Go ahead. Okay, go ahead.
Those who are arrested, or those who are normally arrested, how do you treat them? Are they taken to court? Because drivers are taken to court. So these people who are not observing this social distancing, if you arrest them, how do you treat them? Because we call the police and the PRO is saying that he is not aware of it. And those who are doing the arrest are security officers. So where are they taking those they are arresting? The second one is Ker Ado. We are told that it has become a routine place and you are trying to establish a security post there. Is it that the security did not have enough men to be posted there? Why is it that up till now, there is no post there? You are still, it's almost 2 or 3 weeks now we are hearing that it has become a routine place and you want to put a security post there. Why is it that still now there is no security post there?
Thank you very much, Doctor.
Thank you very much. With regards to the question about Ker Ardo, I know to establish a police post or a point of entry where you think of having all these key security apparatus, like, for example, you have to get SIS, you have to get the police, you have to get the customs. So it must have to be a designated area. It may not be capacity, it may not be staff, capacity, for example, but actually it might be a responsibility whereby we can also be able to think of the human resources. And I'm so, as we are discussing this, we also need to get in touch with the governor's office because all the stakeholders are very key in this. So we don't want to rush and do something. I don't know that tomorrow it could be a challenge for us. Perhaps maybe also we need to think of now where do we need to put them? They need to have offices. They also need to have accommodation. They also need to have electricity in those places. So all those things can be done overnight. So that is why we started discussing this about a week ago, and now I'm sure we are going to finalize it. By the time we come back again, we should be able to tell you the developments with regards to the functionality of the post in Kerado. That's a concern to all of us because we know it's an area where people can just come in through and then just go straight to the Gambia. And I think people can equally live to the Gambia through that way also. So it's a concern for us, and we're going to address it. The other issue is about the issue of, I forgot the other question. Can you remember? Huh? Yeah, the people who are arrested. We will get the details of that, and then what next? Because I know that in this committee, we have several subcommittees under the National Health Emergency Committee. This committee, there's a committee on logistics and security. The securities are doing their work, and they are also arresting. So where they are also taking them after arrest also, it's not clear to me as far as I'm concerned at this point in time. But by the time tomorrow we have a meeting with the security, they will make a report on that. Then we should be able to take details of where these people are taken and how many of them are there. Then tomorrow, inshallah, we'll come and give you that of the complete detail on that one. But for now, and then anybody who is arrested, they'll be charged, and when they are charged, they'll be taken to court. Be rest assured of that, because they are breaking the laws. So anybody who breaks the law, automatically you'll be charged, and when they are charged, you'll be taken to court. And that's what that one will happen. They will not be just arrested and left like that. No, they'll be arrested, and then they will take the procedures, and the procedures will be taken. And once they are kept somewhere, then they will be preparing their charge sheets. When they are charged, automatically they'll be taken to court, and when they are taken to court, they'll be fined. Just like breaking public health laws is just like breaking any other law. It's the same law. As long as it is a law, it's a law. Breaking the regulation on public health emergency and state of public emergency regulation, automatically you'll be taken to court, and then the due process will follow, and then you'll be charged accordingly. Thank you.
Media organization name.
Mentioned my party about the frontline payments. And when it was reported in the news, the biggest question was, how about the 12 million given to them by AfriCell? The said 12 million given to them by AfriCell for the frontline. So to confirm, how are they benefiting from that 12 million dollars? And another question, how far about the Madagascar's vaccine? How is Gambia, using it? Or are they ready to use it? Or how far about it? And another thing, sorry, 3 questions.
Just stop it there, but when I'm done,
Okay.
See, now you mentioned that for the AfriCell 12 million, I don't have much information about the AfriCell 12 million because I know I'm not privileged to get some of the information requiring the payment. But I know that they were consulted on hospitals, if I'm very right. But the 12 million, it has nothing to do with this other list prepared by the Minister of Health. The other list that was prepared by the Minister of Health was about 1,111 people. They are supposed to get the incentives. It is not even an allowance, but just an incentive to motivate the staff that are doing the work. And then the initial top-up was given to each and every one of those 1,111 people at a cost of about $5,000. The whole idea is, I think I explained this thing here many, many times. The whole idea is like, we are still trying to find out who are the frontliners, and also what if we look at the risk stratification, who is at higher risk, who is at medium risk, and who is also at low risk. Those things have been identified. Now, somebody is on high risk. How much is the person going to be paid? We've also not finalized. We made some proposals on that, and I'm sure by tomorrow we're going to make conclusions on that. Who is at medium risk and who is also at lower risk? Again, after the declaration of the pandemic, who was involved in the process from January to April, for example. We know after when we got the results around the 17th of March, then we got many people to join us. And then some people started working with us in March. Some started working with us from February. All those things have been put into consideration because we don't want to ensure that one person is paid you work for only March and you are paid from January to April. You know that is not fair. So all those things, because we have, I think apart from education department, ministry, we are the highest number of staff. That's the second biggest ministry. So therefore, if that we have to take our time. We don't want to get the blame. Whereby some will say others are paid and others are not paid. So we are looking at who are the people who were involved from the start. And now that the payments, currently I've just been making a follow-up with the PS to see how far we are going with the payment. And I think that they're now waiting to finalize that of the regional health directorates. And what we did was like at the central level, we knew who were the ones who were involved. But at the regional level, it may be difficult for us to sit at central level and decide for the regional offices. That is why they have been given the opportunity to one of the regional directors to represent them here to be able to start working with them. They've been working behind the scenes, and then now, I think last week, was it Monday or Tuesday? No, last week, no, this was it yesterday, or I'm not too sure, but it was just like last week, they had finalized their list that provided from all the regions. You know, remember we have 7 health regions in the country. All those regions now have submitted their list, and they're going to do the finalization by tomorrow. So when we are done now, then we can now decide who should be paid what and from what period. So this is what we are doing. That payment or that payment of incentive, for me, in my opinion, it has nothing to do with the 12 million official provided. I don't have much about that because I know official is intervening in hospitals. Dr. Bide is here, he will be able to tell you because he has direct contact with the hospitals. But that is my opinion. But I think the 12 million for me, it is not part of this other list that the government, that is the 500 million where the allowances are supposed to come from. They are totally different. Thank you. The third question. Madagascar. The question about Madagascar herbal medicine, you remember there was a day we were at the Kotu Center medical stores a week ago. The minister made it very, very clear that it is at the level of the ministry, and now that ministry cannot also release for it to be used without going through various processes. And now that it has to go through screening, checking here, there to look at its effectiveness and its safety, all those things. And the minister told you that at that meeting that a technical team have been formed to look at the team of scientists and who are going to look at that and then come up with recommendations. So anytime they are ready with their work, they'll come with the recommendations to the honorable minister, hand over their recommendation, and the recommendation will be either we use it or we don't use it. But I also want to tell you that we are still waiting for them to come up with the recommendation. That is what we are waiting at this point in time. But let me also tell you that the country where this herbal medicine is also coming from, they're also still having some cases. So I think automatically we are just it could work, it may not work. So we just keep on trying and our best, and then when it works for us to use it, we'll use it. When we are not supposed to use it, based on technical advice from experts, we are not going to use it. That's the whole idea. But we have to wait for the decision of the technical experts.
Thank you very much. Dr. Vita would like to excuse. He's attending another meeting. If you have any question for him, you can ask now or that. Okay. Doctor, say you are excused.
My question is frontliners. Since when this COVID-19 started, people have been explaining to us that there are frontliners. You want to know who exactly are frontliners and which sector exactly is considered as frontliners. Is it only nurses? Because we have police who are at the borders. We have people who are doing this service and they are not health officials. Now, when you say frontliners, are you referring to only health workers? Or are you referring to anybody who is a first contact to the patients or to those taken to quarantine?
Okay.
Who exactly are you talking about first?
Thank you.
Frontliners.
Anyway, National Health Emergency Committee is a multi-sectoral team. And as you said, the frontliners are there, the second liner, the third line, depending. Yeah. So those who go and take samples are automatically frontliners. He wants to know what are frontliners, the definition of frontliners, and whether others who are not in the medical field for the committee.
No, maybe the frontliners. We have people who have direct contact with people who are affected or infected with the virus. It could be different categories: the laboratory, the surveillance, the contact tracing, the rapid response team, the burial teams, the case management, risk communication. All of them are part of the front line. The people, I'm coming, the people giving supplies, delivering supplies to the people who are already are there. The security is also providing security services for those people and their families who are on quarantine. For example, if a family is supposed to go on quarantine, they will remove everybody from that house, and then that house is going to be secured. So the securities accidentally can just go in the house, get in contact with any of the individuals there. So anything can happen. Or maybe through the process of trying to move them, and some people insist, and in that process anything can happen. So each and all those people are frontliners. They are frontliners. They are at risk. That is why we said, okay, they are all at risk, but let's do risk stratification. And risk stratification, we look at high risk and medium risk and the low risk. The high risk, somebody who goes to collect the sample, is high risk. Anything can happen to that individual. The laboratory person who goes to collect the sample, the doctor or the nurse who is treating the person, or who is at the quarantine center, is also at high risk. I remember me and him, we are also at high risk in communication. And we went to one community, anything could have happened because we are dealing with the community directly. So the communities can easily, case us out, or they can attack us. Anything can happen. We are also at high risk. The journalist yourself, holding the mics, talking to me, that's why I have to put on the mask. If I am to be having the virus, for example, I can throw it on your mic, and then you go and touch your mic and you infect yourself. So that's why we are advising that people should be able to wear the mask. That's why we are encouraging that. Anything can happen. So all of you we are all frontliners. The media personnel are also frontliners. Because anytime we move, you are moving with us. Wherever we are, you are there. Last time we took you to the quarantine center. And the people also at quarantine center are also frontliners. Because they are dealing with the people at the quarantine. And the people at the point of entry, those who are seeing them, getting into contact with them, putting them in holding centers, putting them in isolation centers, they are also frontliners. So you can see it has a long definition with various components in it. So all those people, all of us are the frontliners. But our degree of transmission or exposure to transmission differs a lot because of our operations, our level of operations. I think this is what I want to make clear at this point in time. Thank you.
Thank you very much, Director Modunjai, for that elaborate explanation on the definition of frontliners. I believe you're all satisfied for the day. All questions answered. Now it's time to prepare for breaking of fast, or fasting of breaking, whichever. All right. On that note, I would like to thank you all for the usual support and interesting questions. See you tomorrow. You wanna snap it? Yeah, only one. You have to snap it. I'll take the one from there. Oh, yes. When are we having